I don't do well with either of those, but particularly needles. My wife laughs like, if you're gonna do a needle, my husband has to stand outside.
Yeah, I'll tell you a quick story. One, and answer your question, I don't have an issue with that. I actually enjoy observing soil
Ugh.
or have the opportunity to.
If you
I
tell me you watch the TV show Dr. Pimple Popper, I'm ending this conversation right
no,
now.
I
This Up to Speed podcast is made possible by Legislative Solutions. Legislative Solutions knows New Hampshire's politics inside and out. With years of experience and a results-driven approach, they're the go-to team for anyone looking to make an impact at the State House. Find them at legislative-solutions.com. Welcome to another episode of Up to Speed, made possible by our friends at Legislative Solutions. I'm Michael Graham, managing editor with New Hampshire Journal, NHJournal.com. The goal of Up to Speed is to take busy people like you who are trying to keep track of everything going on in government, politics, policy, and find out in 30 minutes or less what's going on in a specific corner of the economy. What's more significant in New Hampshire than healthcare and the hospital sector? John Skevington is with HCA. John, welcome, and please help get us up to speed.
Great. Thanks, Michael. Thanks for having me this morning.
Well, first of all, a little bit of background. You've been with HCA in various roles for a while. Could you kind of give us the bio, particularly as it relates to hospitals here in the Granite State?
Yes, so I've been with HCA for 17 years, started out in Southwest Virginia. HCA is a national organization. We've got 185 hospitals and four hospitals here in the state of New Hampshire now. Came here in 2011 as part of HCA's executive development program, and I have spent time pretty much equally between Portsmouth Regional Hospital on the Seacoast and
Mhm.
Parkland Medical Center here in Derry, New Hampshire, and now for the last 5 months as the CEO of Catholic Medical Center in Manchester when HCA acquired CMC in February.
So I want to talk specifically about those properties and what's happening, but let's start with the big picture. When you, as a hospital administrator, that is, you've got medical care, you've got financial resources, everything over here, and you look out at the map of New Hampshire. How would you describe how well matched the resources and the need are in the Granite State today? And if they're not well matched, what would you like to see happen?
I think there's always room for more access. And if you look at what HCA has done over the last 10 years is provide that access. We're a rural state by nature, very
Right,
spread out,
exactly.
1.7 million people, about a million people south of the lakes region. And it takes a long time to get to places. And so, if you look at emergency room care, for example, since the pandemic and with the challenges in primary care, that's not just unique to New Hampshire, but everywhere.
Right.
Patients are going to emergency rooms. They're looking for more convenient care, and that's what we've been trying to do is take care close to people. You look at the freestanding emergency rooms that we've stood up in Seabrook, Dover, and now Plastow. Those have been winners for patients in
Right.
those communities. The patient satisfaction, the wait times, the satisfaction is high, wait times and length of stay is extremely low. And so that's just part of one thing that we're trying to do with HCA is bring care closer to patients and keep them in New Hampshire, right? There's been academic medical centers from outside the state that have wanted to come in to some extent,
Mhm.
take patients for their higher level of care outside of the state, and that's not what we want to do. We think patients should be able to get that care here local.
Did you have any concern when you went into the hospital industry? Like, for example, needles and blood. I don't do well with either of those, but particularly needles. My wife laughs because she has a lot of medical issues, and she's like, "If you're going to do a needle, my husband has to stand outside." Is that a part of how you got, like, were you drawn to the medicine part, the administrative part?
Yeah, I'll tell you a quick story. One, and answer your question, I don't have an issue with that. I actually enjoy observing soil
Ugh.
or have the opportunity to.
If you
I
tell me you watch the TV show Dr. Pimple Popper, I'm ending this conversation right
No,
now. I
I do not.
cannot. Okay, good.
But I'll tell you
Ugh.
that I was drawn to healthcare because of the impact that you get to have on people, and particularly a wide range of folks. I used to do manual labor during high school and college, to make ends meet.
Sure.
and I got an opportunity to do an internship at an HCA hospital in my hometown of Kansas City. This is not an exaggeration. I was going to my orientation, my first step into that hospital. Somebody came up to me and said, "Hey, I need your help. I'm looking for this department. I can't find it." And I happened to see the sign right behind him
Right.
and got him to the department. But that was an eye opener for me. I got to help somebody, and it
Right.
was very simple. And you don't get to do that in a lot of industries in the same way that you do in healthcare and
We,
see the outcome of that.
right. We get, by the way, a whole side conversation about ribs, Kansas City,
Yes.
and how you cannot find decent ribs in the Granite State. We'll move on beyond that. You talked about impact. I know a lot of people were concerned about the impact of having HCA step in for Catholic Medical Center. It worked off the nonprofit model. It was obviously, the Catholic Church was directly involved. New Hampshire Journal covered the transition. We were in at the meetings, listening to people speak, and a lot of concerns and a lot of promises were made. How do you feel like it's going 5 months into that transition, and what kind of feedback are you getting from the community?
Yeah, I think 5 months in, as planned, there's a lot of change and getting to know each other, new organization. We're getting to know all the folks at CMC who are fantastic, by the way. So proud to be a part of this community, and I've been really just blown away by what CMC really means to Manchester, particularly the west side of Manchester. Um, and I think the impacts are really just starting, right? So we've started to capitalize this facility in a way that was not able to be done under the previous ownership.
Can you give it an example of something that you plan on spending money on that people will eventually see the results of?
Yeah, right now we're getting ready to replace our electrophysiology lab that was sorely needed. This is a heart hospital. It is the premier heart hospital in New Hampshire.
Right.
Investments like that are absolutely necessary to keep that going. So that's starting this summer. Starting next week, the public's going to be able to see visible changes happening in our lobbies and public areas as we sort of refresh everything, and extensive capital even behind the walls that folks won't be able to see to maintain the facility. New windows will be coming later this year. So things like that that'll be very visible and tangible to everyone. And then in addition to that, we're maintaining our commitment in the community. Our colleagues have been out volunteering with different organizations. We've been active in providing community contributions as the foundation that's going to get stood up as a result of the sale. They get their feet underneath them and then they're start able to do more active contributions in the community. People are going to see and feel that impact. And then, of course, with the city, they're going to see the impact of tax dollars that'll be generated.
Right. And that's a good point. Leads me to the next question, because one of the conversations that was part of this transition, people were saying, we don't think hospitals should be for profit, that the entire medical sphere should be a nonprofit, area. No one should make profits. It's interesting. When I was a talk radio host, I was a frequent guest in Ireland for a long story. And I was in a debate with a healthcare professional who said no one should be allowed to make more than 100,000 euros a year in medicine, period. And I'm like, that's terrible. And they're like, well, how, what? So are you kidding me? Because then everybody who's at the top of the game will go become a stockbroker or something. I want the richest guy in the country to be a guy who drills a hole in my head and fixes my brain. That's what I want. So what do you say to the argument that the idea of HCA is fundamentally flawed, that healthcare should be a community good and therefore that should not be a profit model?
There's a famous saying in nonprofit healthcare: no margin, no mission. It's
Mm,
it's really just a matter of your tax status. But as a investor owned entity, you can actually do both. I mentioned that the foundation is being stood up that's going to continue to carry on those philanthropic activities that
right,
CMC was known for, in addition to the tax dollars that are generated. And HCA is very active in the communities that we serve. Parkland and Portsmouth have been HCA facilities for 40 years. We're not going anywhere in this state. We're making an investment, and that means being part of the community as well. And so, in addition to those other entities, HCA and CMC are going to continue to contribute to the community, just like some of our nonprofit colleagues do here in the state.
could you give us a big picture in New Hampshire when it comes to having babies? I know there's been a lot of conversation about that, obstetrics, and of course, the big picture is that just not enough people are having babies in the United States in general, in New Hampshire in particular. So two things, what is the status from the hospital viewpoint? And then this is kind of an abstract question. I have no idea if you have the pieces to, but I'd love to hear your answers. Is there a public policy thing that can be done to encourage people to have more? I mean, you're a Catholic, you talk about it in your mission statement that you are Catholic personally. I mean, is there a way to encourage people to have the kids we need to have in America 100 years from now?
I don't know about a policy statement,
Mhm.
but I can say that, providing birthing services is incredibly important to us at this hospital and will continue. And so we actually just launched a new midwifery practice that
Oh,
started on the first, New England Midwifery. They're fantastic. We're recruiting OBGYN providers to continue to come to this community that are in addition to the providers who are already here in the community. And so that's an investment that HCA is going to continue to. The birth rate in New Hampshire is a struggle. It has been declining for many years, and I would not pretend to know what the answer is
okay.
to that. I'm just ready to be able to take care of those patients when they need that care.
Well, I have to thank you right now for correcting my pronunciation of midwifery, which I had been A, totally mispronouncing, and B, I love saying midwifery. What a great word. I love that word. And and it's interesting. I see a lot of parallels in the conversation we're having about birth rates, et cetera, which with other government or not other government, you're not government, but community activities. For example, as the number of education K through 12 students declines, you have to make changes, and yet communities don't want to make change. I want my kid to go to the same high school I went to. Well, when you were in high school, you were part of the baby boom, and there were 1,000 kids in town. Now there's 700 kids in town. I mean, why can't we keep all of the birthing facilities we had before the same way they were? Well, when your birth rate declines by 40%, it's going to be felt. I mean, is there something I'm missing here?
No, I think you're exactly right. Change is always tough, right? And
Right.
it's hard to, be able to articulate the need for that in a way that makes sense to everyone. But I think the important thing, and this is what we are really focused on, is doing it well and doing it right. It is, we've been very fortunate in this country to have a very good medical system.
Right.
We can always make that better, and it's important that we stay focused on continuing to have high volume, optimal birthing centers that are staffed by really great providers and clinicians.
So we were very fortunate. At the same time, we hear reports that there are certain parts of the community of the labor pool for medical care that are struggling. Where is the greatest need in New Hampshire from the people who have skills side of the equation?
Certainly nursing, and that's one you always hear about.
Can I interrupt you right there? One of the
Yeah.
things that we've discovered covering nursing, and which I knew nothing about 4 years ago, is that is a big word. I mean, it goes from people who carry bedpans all the way to people who are one step away from doing heart surgery. So, can you be more specific about where the need is?
Yeah, that's exactly right, and it's broad. It's broad because the typical pathway for someone who wants to go into nursing could be start in nursing school, go to the bedside, and then
Right,
specialize out, or as you said, a nursing assistant who can get faster entry into the workforce. What we've done is really recognize the fact that you've got to grow your own. There's not enough nurses in New
right.
Hampshire. And so we have to make that an appealing calling for folks, not just a job, but it's a calling, right? Taking care of one another. And so HCA has been incredibly invested in learning programs, our nursing residency, our nursing aid residency programs. We help provide scholarships and education support, and then creating a good pathway that gets folks into the organization. And then, maybe 10, 15 years ago, you had to put in your normal time as a bedside nurse, start off at
Right, right.
night, and then work your way throughout there. That just doesn't work anymore. And so you have to be able to help navigate folks who are new into the workforce, into the specialty areas that they want, and then get them the training to be successful there. And so that's what we've been focused on. And I will say, Michael, the other thing, nursing gets a lot of attention.
Right.
Primary care and physicians and advanced practice providers too would probably be number two on my list. At Portsmouth Regional Hospital 5, 6 years ago, we started a graduate medical education program, which is now up above 70 residents, training people here in the Granite State. And that's important because that program was started with the intention of doing two things: helping to feed our primary care networks, both in
Right.
internal medicine, in family practice, and psychiatry. And when you train somewhere, you're more likely to stay there. And
Right.
so that's the goal, is to train folks here close to home, keep them here in the Granite State, and provide access to primary care.
So, what is something that you would say right now is just ridiculously, or I'll ask it a nicer way. I'm sorry, I'm not trying to cause trouble. Something that's unnecessarily expensive in the system, that because in healthcare, that because of whatever the way the system works or the rules, whatever, that there's a kind of care that has the most opportunity to bring price and cost, together.
Yeah, I mean, that's a tricky question.
Mhm.
And you put me on the spot a little bit there. What I would say is, and I get this question a lot. I
Mhm.
think what people don't recognize about the cost of healthcare, and there's some sticker shock there, right?
Right.
They don't understand, like you said, you want some very bright minds taking care of you when you're in an
Absolutely.
emergency. And so I can speak from the hospital side of things, right? We have to be open 24/7, whether there's patients there or not in a
Right.
lot of our departments. That comes with an inherent expense. All of the equipment and tools that we use are very expensive, not
Right.
only to purchase, but to maintain. And then our staff, our physicians, everyone you come in contact with is very highly educated and very well trained. And so inherently, healthcare is expensive. Are there opportunities that we can all work on to reduce costs? Absolutely. One thing that we did at Catholic Medical Center as part of our commitment to taking over is we used to have a lot of hospital-based clinics here
Mhm.
that are a little bit more expensive than traditional professional-based clinics. We converted those from hospital-based clinics to traditional professional-based clinics, and that's going to reduce the cost of
Right.
care to patients.
So let me ask you the other side. When you first got into the hospital industry, something that is available now that you're like, wow, if you had told me when I first got in that you'd be able to get that kind of care and get it for not a gazillion dollars, I never would have believed you. This has been a real radical change. What would that be?
Well, I think the shift to outpatient care is
Hmm.
very different than when I got into healthcare. Ambulatory surgery centers that are more standalone. They don't have to be open 24/7, so they can
Right.
have a lower cost structure. That's one. And I think we're really only starting to see the beginning of the advances of, things that can be monitored on your phone, right? And
Oh, okay.
you don't have to come into a bricks and mortar organization for.
Right.
There's still always going to be a place, right, for emergency care with, the tools and people to be able to take care of you, but there's been sort of a constant evolution of more access and more access from home. Telemedicine is probably the best
Right.
example.
It's funny you say that. I just made an appointment before we started this for a encounter with my doctor. So it's happening. What do you say when people say the word AI to you? Do you run away? Do you hide under your desk? Do you say we're already working on that?
Are already working on that. In fact, our entire company is going through a change in our medical record system for a lot of reasons to modernize, but part of that is
Sure.
also to make it more nimble to be able to utilize AI. A lot of our nursing leaders spend a lot of their time trying to staff their units, complex 24/7 hour operations. We're piloting in our company AI programs that can take the hours of work that our nursing leaders do and have that schedule made in just a matter of minutes. And then they can take that time and spend it on their staff and their patients on the unit. So, no, I say embrace AI. We're still learning about it,
Sure.
right? It's not an open, we got to be very careful with how we introduce it and what we introduce
Sure.
it for. But I see certain advancements.
So we talked about the physical environment of New Hampshire, that you've got a million people below the lakes. You've got these other people who need care in rural areas. But what about the regulatory environment? HCA operates in a lot of states. How would you compare operating a hospital, being able to be as nimble as you want to be in New Hampshire versus other states?
I would say it's probably more nimble. Certainly has gotten that way over the last 10 years, and I think that's a good thing. You have not seen a giant proliferation of unnecessary services out there. Urgent cares have certainly come into the state like they have in other states, and I view those as complementary to the services
Right.
that we provide. I think that's been a good thing for patients here.
Well, let me
Um,
interrupt you right there because a lot
yeah,
of people don't agree. As you know, the legislature just in New Hampshire just considered and I passed the law that took down that circle that says you cannot have a similar service providing within, what was it, 25 miles? I'm doing this
15
from
miles of
15 miles.
critical
That's it.
access
So
hospitals.
what you don't have a problem with that competition?
No, I won't comment on that one in
Okay,
particular. I'm speaking to the overall
got it.
environment of New Hampshire where you mentioned telemedicine, urgent
Mhm.
care.
Sure.
These are good for the consumers. They're more convenient than the way we were providing care, and there's a role for them. And so I think that's a good thing to be able to have that type of environment in New Hampshire.
Well, since we mentioned legislation, I always ask everyone the same question. I'm giving you my magic wand. You get it one time. You can get the state of New Hampshire to pass any law, and the governor will sign it. What one law would you like them to change, pass, etc.?
Well, I think they've already done it and heard from hospitals, which is helping to come up with a deal to continue to help
Right.
hospitals with our Medicaid programs and
Mhm.
being able to expand those. We've got a bigger issue on the federal level right now that's brewing as we
Sure.
speak. And I don't think a lot of people know how many insured people are at risk if enhanced premium tax credits expire at the
Mhm.
federal level, and the threats to what states can do for Medicaid. And I know Medicaid can be a loaded word for a lot of
Sure.
different people. The fact of the matter is that there are more patients that have access to health care than they did recently, and that is better for the overall cost of healthcare for the entire state. And the nation as a whole. And so I'm thankful that the legislature, the governor, helped to partner with hospitals to be able to come up with a deal that helps hospitals be able to predict some of our expenses in the future.
See, mine is I would mandate that you guys have robes that actually cover my tush when I put them on because I can never. First of all, if I can't get them on because you have to where the sleeve starts, and then there's this extra string on the front that no one has ever explained to me what it ties to. So that would be my mandate. The hey, get a robe Michael Graham can work mandate. I don't suppose not
That's a
working on
good one.
that. Not
That's
really
a good
gonna
one.
work.
We'll certainly name that after you.
Well, thanks.
Maybe have a good
So
visual.
thanks so much. And thank you for your time, John Skevington with the HCA. Thanks for help bringing us up to speed on hospitals and healthcare in New Hampshire here at New Hampshire Journal.
Certainly. Thank you, Michael.
This Up to Speed podcast is made possible by Legislative Solutions. Legislative Solutions knows New Hampshire's politics inside and out. With years of experience and a results-driven approach, they're the go-to team for anyone looking to make an impact at the State House. Find them at legislative-solutions.com.